gentlemen, welcome to another interview with two distinguished healthcare professionals and the proud owners of Rooted in Rehab, Dr. Baylor and Kathleen Sieg. Today we'll have the privilege of delving into the minds of these accomplished doctors who have not only established a thriving healthcare business, but have also redefined the approach to patient care. Dr. Baylor and Dr. Kathleen bring a wealth of experience and expertise to the table, creating a dynamic partnership that is the backbone of Rooted in Rehab. With a shared commitment to providing top-notch healthcare, their journey is a testament to the power of personalized and integrated approaches in rehab. Hello, and welcome to the interview today. How are you guys doing?
We're doing well, Susan. How are you?
Awesome. Thank you so much. And thank you for coming on here and giving us a little of your expertise and getting to know some of our community here.
Thank you for having us.
Great. Well, my first question for you guys today is, can you provide our audience with a little overview of Rooted in Rehab and the unique approach you have to healthcare?
So I'd say overview of what our company is about is really patient-centered care. We both used to work for prior companies where we were much in control of kind of what insurances were basing on how we could treat and the time amount and the amount of sessions in a given treatment rehab session. And we really believe that you can get a lot done, especially combining our two professions quicker if you give the right amount of time frame in each session to a patient that's required. So
nice.
Only one-on-one with our doctors. In a lot of places, you'll see that they have techs or PTAs or chiro aides where you don't get to spend your whole session with your doctors, but in our company, it's all one-on-one.
Mm-hmm.
That is, wow, that in itself is unique. That's completely, I mean, I just went to the doctor's. I can tell you, I saw him for 10 minutes, the rest of the time was with everybody else. So what a great approach.
Thanks.
What inspired both of you to establish Rooted in Rehab, and how has your vision evolved since its inception?
So I would say the step that kind of got us involved with Rooted in Rehab is primarily, I think, just dealing with insurance companies, what they cover, what they don't cover, and really seeing some of the patients that we had that would, I guess, supplement out with their insurance. So not only were they taking insurance, but then they were also wanting to do some of the things that weren't necessarily covered. And so while they did have to pay out of pocket for that, which is unfortunate, they got better a lot quicker. The second thing that we started to notice is as we referred either to physical therapy or chiropractic, the disciplines didn't really like to work together that much. And they love to step on each other's toes. And so one of the ideas behind Rooted in Rehab is, even using combined therapies of, back-to-back chiropractic, back-to-back physical therapy, what we saw was that patients got better a lot quicker. So instead of 4 to 6 weeks, it might be 2 to 3 weeks that people were getting better quicker, just because of the unique discipline that we both have.
Right. And I think, to just piggyback on that, we have a wide range of patients and clientele that we see. Thankfully, our education has trained us in every part of the body, the neurological system, vestibular issues, and we wanted to be able to kind of bounce back and forth in one session to be able to treat patients and give them everything that they needed, instead of just being honed in or focused maybe on just one area.
So my next question is kind of related to that, because in the realm of patient care, can you share a specific success story that amplifies the impact between your chiropractic, your physical therapy, and then also your manual therapy? I thought that was an interesting part of your business. Can you give me an example maybe of something that has been very successful for you guys?
Yeah. So I'd say a really good example is like take one of our shoulder patients. I'll keep their name out of it for HIPAA reasons.
Thank you.
You know, we have patients that come in that maybe have severe headaches and left shoulder pain with anything reaching up overhead. And when you think about that specific joint, there's a lot that goes into the neck is very in tune with the shoulder as well as the upper back, or what we would call the thoracic spine. So being able to get the spine in a correct position from a chiropractic standpoint, where Baylor really thrives and is very intelligent on the spinal side of things.
Okay.
Be able to set that in place and then have the manual therapy to work all the muscles so that they're not continuing to pull that person back forward, causing kind of that forward head posture, which leads to headaches, as well as like this really stiff upper back spine that won't let your shoulder get up overhead. So once we get that baseline of kind of having the joints in line and the muscle tissue to have the correct length, then that's where physical therapy really comes into tie so that you can get stronger and not let yourself fall back into that position as quickly. So that's kind of our big basis of what makes our concept work is, you know, a lot of times Baylor knows a lot of chiropractors and he can speak to this where you just get adjusted and you leave and you get adjusted the next week and you leave. And we're just not really, we believe that the concept of actually getting better is to actually have that home exercise portion in between as well as the manual therapy so that it doesn't just keep coming back.
Wow, that is exciting. To have both of those at the same time, I can see the benefit from how you're stating it. That is awesome. Now, how do you guys keep advanced in your the latest, you know, of what's going on in your chiropractic world or in the physical therapy world? How do you guys keep on top of all of that? Because I'm sure having patients and having a life outside of being doctors, you know, sometimes might be hard to get all that taken care of.
Definitely.
So we do have our continuing ed credits that we have to get every year. That is basically by the state of Colorado, we have to get so many education hours before license renewal. So that does allow you to stay pretty current. There's a lot of classes, and they don't just have to be isolated to Colorado. You can travel for them. That helps. The other thing that helps is I'm a little bit of a nerd when it comes to reading research and things like that. I love reading research. I love reading what's new. And so a lot of times I would say I usually bring it up as a topic when we have a lot of our weekly or monthly meetings of, hey, this is really cool. This might be on the horizon. Maybe it's time to look into some of these things. And, you know, that's been pretty pivotal in not only, you know, a lot with what's going on in the neurological space, but as well as, you know, how to treat more complicated conditions, right? You know, neck pain can be relatively straightforward for the most part. Whereas if you get somebody with Parkinson's disorder, we're dealing with a ton of different things all at once. And so that's where Kathleen and I are not only caught up on what is the latest research on exercise techniques to help improve, or not necessarily improve the condition, but to have it, you know, not advance as quickly. As well as the chiropractic care and neurological stimulation side of things to help keep them from being so, you know, rigid when they're walking around.
Yes, and I've seen that. I've experienced that personally. So go ahead, Kathleen.
I would say just to piggyback off that with furthering our knowledge, you know, when I do have either of us, but primarily PT with a post-op patient or post-surgical, I work closely with a couple of orthopedic docs when surgical consults needed. And it's very interesting, you know, to touch base with them once a month and to realize where their field is going in advanced research and how to approach that side of it as well.
Nice.
So that I know pre-op and post-op what is best for a patient's condition.
That's awesome. Thank you so much for sharing that. Would you guys consider yourself a small business in this healthcare industry? And with that, what would you say the most significant challenges you've encountered, and how have you navigated through them?
For sure, I would consider us a very small business on the side of things. And I think that, while there are challenges and benefits, we have a lot more control than, say, a hospital system where you have a lot of moving parts, and we have a lot more control over what we do. But one of the biggest challenges I've noticed is essentially people are very resistant to paying cash out of pocket up front. We do provide super bills and things that they can submit to their insurance. But that initial kind of jumping in and saying, what do I get for the price that I'm paying, is a little bit hard. And then once you start getting in and getting rolling and seeing that, we're trying to keep everything at a very, I guess, level place when it comes to the finances, because you might see us for 6 weeks, you might see us 6 times in those 6 weeks, where traditionally, you're going in with an insurance, you're paying a copay, but you might be paying that 2 or 3 times per week. And they usually end up costing about the same out of pocket. The only difference is you don't utilize your insurance.
Yeah. And I would say the other thing, just from working in the past as a cash pay PT, is a lot of companies will add supplemental, add-ons to a technique, paying for kinesio tape, paying for dry needling, like fees on that end. And we just based all of ours off time period. So if we fit it within the time, the patient gets it, and that makes it easy on our end because we can truly treat people with what we think is most beneficial versus kind of basing it off of a fee standpoint. And I would say that the other big benefit about being a small company with right now just being the 2 of us is communication between your doctors.
Yeah, if you guys aren't communicating, I guess your patients would have a problem.
Exactly.
So that's always like a big win, and we know our patients appreciate it. So we always promise people, like, hey, if you're transitioning between one versus the other, know that they're going to know exactly what we did last time, what we think about moving forward. And, eventually we might want to grow a little bit, but we never really want to be a bigger on for that reason.
That's great. Now that kind of segues into the next little question I have. Beyond your professional roles, what hobbies or interests do each of you pursue outside of your business?
So we are both avid golfers. In fact, Kathleen, she won't brag on herself too much, but she did play Division I golf at the University of Wyoming, where we both met.
Nice.
My golf game has gotten better. By no means am I as good as she is. But that's probably one of our main hobbies. We do like to be outdoors. At least I like to be outdoors. I like to ski. But I would say golf right now is probably one of our biggest hobbies.
Yeah. Like Baylor said, we both love to ski in the winter and just be outside. We're both very big family people. So seeing our nieces and nephews, being with our parents, all that type of things, to be able to spend time with them as well as our friends. But as far as like main activity, it's definitely golf on that end.
Well, good. I mean, it's, I think we all learned that it's a live and work kind of situation, and you've got to do both or you get burned out.
Exactly. Right.
I think in our jobs. And so, you're just like everybody else in the world. You need some outlets. How do your personal interests and experience contribute to the unique atmosphere and patient experience at Rooted in Rehab?
I'll start with this. So my background in physical therapy, I was lucky to know that this is something I've always wanted to do since I was in middle school.
Wow.
So I started kind of interning under different PTs that all the way through college, and working for different clinics, both on like the front desk end as an aide and all of this type of stuff. And then in school, I had experience in Children's Hospital, sports medicine department, neurological home health, and then really a couple different outpatient areas that's similar to what we do now. But I think that experience has helped me get a broad look at how I can help the general population and how I want to practice to become more of somebody's initial person when they're asking, hey, I don't feel well, who should we go to first? Colorado, luckily, is a direct access state for both of us, which just means patients can come to the physical therapist or the chiropractor without a script or without having to see necessarily a doctor first. And thankfully, our education has given us the ability to help diagnose and kind of send that patient wherever is best from there, whether it's imaging or an orthopedic doctor or just staying with us. We'll be able to kind of help tease that out. And then the other thing I'd say is, given what I've seen, it's probably driven my practice a lot more to figuring out how can I be a good maintenance care physical therapist for patients. So, a lot of times I think PTs are viewed as like, oh, I had a surgery, I'm going to go see a PT, which is true. But our profession's really starting to take a turn to be more of like you shouldn't live in pain all the time. If something comes up, just come check in. And I guess I kind of view that as like what the standard long-term has been, is like, I'm going to have my monthly massage. And I hope that one day people will say that about PT. Like, I'm going to go have my monthly check-in with PT or like chiropractic and see what's going on, get my body taken care of, figure out what I need to do at home, and see you next month type thing. So
that's awesome. All right. Baylor, how about you?
So I grew up in a very small town. It's called Douglas, Wyoming. It's up I-25 if everybody's ever been. It's a wonderful place to grow up. We had 2 chiropractors in the town, and you couldn't really get me out of the office of the one. I thought it was really cool from about 2nd grade on that he had a full life-size skeleton in his office, obviously for like anatomy purposes. So I hung out with him a lot. So I got to see that from a young age. And then going through, I did do a lot of athletics growing up in both high school, and then briefly had a period where I played some football at Chadron State, which is a small little Division II school in Nebraska. And I think just having a sports background in general allows you to kind of connect with these people. And it may not be a sports movement that you're trying to get better at or trying to rehab, but it does allow you to understand the movements of people a lot better, as well as, injuries. We get a lot of athletes that come in and they're like, I was doing, one that comes to mind is he was just blocking for a play and he got his hand caught up in somebody's shoulder pads. I've had that happen to me. I know kind of what it's like. So it allows me to kind of already understand a little bit more about the sport. And then in chiropractic school, I went to Parker University, which is in Dallas, Texas, and they have a very strong leading in the field of neurology. So I got exposed to a lot of even chiropractic functional neurology stuff there, which really allowed me to see that whole side of things a lot clearer, as well as, just being introduced to a lot of other disciplines within chiropractic care that I didn't even know existed, such as, functional medicine, nutrition, those kind of things, which is a whole other realm. So then combining with all that, then I get exposed to the physical therapy realm and what they do and how they do it. And, at the end of the day, I think just seeing even the differences in the fields allows me to kind of create this hodgepodge of, you take a little bit from the neurology side of things, even though somebody may not have, like, let's say a Parkinson's disease, you can still use some of those tips and tricks that you use with Parkinson's patients for the average everyday person. A big little known fact, I guess, is a lot of people don't understand how much, neck pain is very common amongst people, how much your eye movement actually plays into your neck pain. Right? If your eyes don't move well, your neck has to move more. As it moves more, it gets overused and vice versa. So it's things like that.
Wow. Wow, that's so interesting. And I love that you have all this background that you can bring to the table when you're working with somebody. Well, before we wrap up here and let you guys get back to your busy practice, I'd like to ask you both a question and have each of you answer it for me.
Okay.
If you could name a famous person living or from the past who you would like to work on or treat, who would that be, and why would you want that person?
That's tricky.
You wanna start?
I think the first person that just comes to mind, just out of sheer humor, would probably be Melissa McCarthy for me.
Okay.
She's just one of those, again, I don't know any celebrities, obviously, personally by any means, but I think given the fact that she would probably just have a lot of entertaining questions and comments throughout that would make it very humorous, I would have to say that she would be one of my initial thoughts to have an enjoyable treatment with.
There you go. See, that's great. Okay, how about you, Baylor?
I'm going to go a little bit more of a nerdier direction. I think Charles Darwin, for anybody who doesn't know who Charles Darwin is, he founded basically, long story short, dominant and recessive traits, which are, anyway, he studied pea plants. I don't want to get too far into it, but I think it would be incredibly interesting because some of the science that's coming out right now kind of combats some of the things that he found in his initial research, and just to pick his brain on, why did he go the way he is? A lot of people blame things on genetic traits and characteristics, and a lot of these new and up and coming geneticists and things are starting to find out that our environment has a lot more influence on these genetic expressions than necessarily. Well, yeah. So that's I guess that in a nerdy sense, that's probably who I would love to treat. It would be a long treatment. I'm sure we would probably be more talking than treating.
Well, that's great. And I really appreciate you, Dr. Kathleen and Dr. Baylor, for coming on today and giving us a little picture into your world and how you help our community here in Southwest Littleton, Kincarl area. So just want to thank you again for coming on and wish you all the success in your business.
Thank you, Susan. We really appreciate it.
Yeah.
All right. Have a great day.
Yep. You as well.